Okay, welcome back. And thanks very much for joining me today for today's webinar on the BioFlex personal therapy system for treating sinusitis symptoms. And the reason why I want to do this webinar is I've talked a little bit in the past about sinusitis, that kind of thing, but it creeps up a lot and it's such a common issue. And, some of the research has shown that photobiomodulation therapy can be quite helpful given the mechanism of action of how it works. So that's what I'm going to talk about today. I do two types of webinars every month. One is for our consumer line of devices like the personal system P120, P180, the Miniport home system, those kinds of devices where you can use at home. They do not have a class 3B laser because that is a restricted device for healthcare professionals. And I also do a webinar every month, typically for professional healthcare users of our BioFlex professional systems. You're welcome to watch any or all of them if you'd like. I sometimes get a little bit more detailed in the professional system ones for healthcare professionals, obviously, and the advice I give is a little bit more geared towards that specific equipment. Today's webinar, as all webinars, are recorded, so eventually they're edited and then they're uploaded onto our website. So if you missed it, you can always check back then. And as long as you register, you should get a link with the webinar at some point within a week or so of the initial broadcast date. So I'm going to review about our systems and photobiomodulation therapy, kind of how it works, and then I'll get into sinusitis and a little bit about how sinusitis is treated conservatively or, typically in medicine, and then how photobiomodulation can help with that. I'll share some of the research that's out there. It's quite promising. And then I'll talk a bit about how you might use specifically the P120 or P180 for the symptoms of different types of sinusitis. I always have time for questions at the end, so just type those into the Q&A box. And if you're listening in, type in the chat box your name and where you're from. If you have any equipment, that would be great to hear. And if you can share any stories, hopefully positive ones, but any feedback is good with the audience as well in the chat box. I'd really appreciate that. My name is Dr. David Kanashko. I'm the medical director here at BioFlex Laser Therapy based in Toronto, Ontario, Canada. So many of you are familiar with our personal home systems. These are based on our professional systems. They have similar protocols, different sizes. P120, P180 refers to the number of bicolor superluminous diodes. And more recently, we have put out what's referred to as a Miniport home system, very similar to the P180, except that it has greater functionality with respect to its software. So it has a greater, more sort of choices for protocols and parameters, and slightly greater output of power in the pad as well too. If you haven't seen these devices or you'd like to learn a little bit more about them, you can always just scoot over to our website. It's a new website. It's bioflexwave.com. We also have our standard bioflexlaser.com site as well too, if you're interested in the professional equipment or a bit more of the research. So all of our systems are based on a bicolor superluminous treatment array that has both red and near infrared light emitted out of the same diode. This is unique. No other company has this. So each of the diodes will emit two wavelengths, first red, then near infrared wavelengths. The advantage of this is that the diodes can be packed close together, so you have a higher energy density. If you have, say, a device that has red diode and then a near infrared diode next to it, they're spaced out so that the density of the red or the near infrared is going to be less. As I mentioned, these devices emit two forms of wavelengths, red and near infrared. The red is around 660 nanometers, plus or minus 5-ish, 10 nanometers around there. And near infrared is invisible. For many people, when they first use the device, they get a little confused. They don't see any light coming out when it comes to the near infrared, and that's because it is invisible to the naked eye. If you have a an iPhone or something similar. I think most phones do it. You look through their camera lens, you'll see a glowing kind of violet purplish. It picks up the infrared, so you can actually see it. And today I'm going to be more focused on the near infrared because that's what the research is showing to be the most effective for the symptoms of sinusitis. So I'll talk a little bit more about that as we go along. The controller device looks something like this, where you have different protocols. We do have a face protocol, facial pain protocol, but that's actually not the one I'm going to really focus on today to use for sinusitis, and I'll describe that as we go along. There are 4 treatment stages or sort of intensities, you might say, of light. And it's not just the amount of light coming out, it actually has to do with how it's also pulsed as well. So, there's sort of 1, 2, 3, and 4, and it's sort of increasing in dosage and pulse rate. And typically we start with level 1. Now, for sinusitis, I'm going to throw this completely out the window and not use level 1. But again, I will get to that as we move along. The Miniport Home, if you're not, I know a couple of people mentioned about having it. They seem to enjoy it. A little bit more sophisticated software. The light array is a little bit more powerful. Greater choice for protocols and for levels of protocols. And it's a touch screen, and it's pretty easy to use as well too. So photobiomodulation therapy, oftentimes referred to as red light therapy, which is, yeah, that's just what people know it as, and that's fine. But really, it's photobiomodulation therapy. That's the medical index science term used when you're searching for this in research, as well as what most researchers are referring to this phenomenon as well. And really, it involves specific wavelengths of light that interact with photoacceptors, or they're called chromophores, inside cells. And they do different things. Now, chromophores or photoacceptors are just things in the body that absorb light. The easiest way to think about this is melanin, which gives you skin color, right? The darker your skin, the more melanin that you have. Melanin absorbs ultraviolet along with some other wavelengths as well. That's why it's protective of the skin. So that's an example. And it's a pigment that's secreted by melanocytes, which are a form of cell. I'm sure you've heard of melanoma, cancer, right? So that's an example of a chromophore photoacceptor. There's many. One specific is in mitochondria, and it's called cytochrome C oxidase. I mean, I'm not going to go into a lot of detail here, but essentially what happens is when you have inflammation, it causes cells to kind of reduce their ability to metabolize. That is, these cells in your tissues have a harder time replicating, repairing, and regenerating because inflammation has a byproduct inside the cells called nitric oxide. And when nitric oxide is an interesting molecule in low concentrations in the cell, it's stimulatory, but when it gets too high, it becomes inhibitory. And inhibitory because it binds to this enzyme, cytochrome C oxidase, and it blocks or slows down the rate of ATP, or adenosine triphosphate, which is the energy that your cells need to do all those things that cells do, including repair, undergoing mitosis, and all of that. The energy of the light, red and near infrared, is what this chromophore absorbs best for different reasons I've talked about in the past. And it actually breaks the bond, the hydrogen bond of nitric oxide that's slowing everything down in this photoacceptor. The nitric oxide then sort of breaks away, and then it goes out into your blood. It diffuses out. While it's doing that, oxygen can bind back on because it was competing for the oxygen, and now these cells can start to recover. That's essentially how photobiomodulation therapy works. There's some other mechanisms there for sure. That's the most well-known one. And there's 2 types of effects. There's direct effect, where the light is absorbed directly by the cells, and you would think, oh, okay, that makes sense. But light doesn't go very deep in the body, and that's part of the problem, right? So there are limitations. But also lights, and that's called a direct, by the way, this is called a direct effect, right? There's also something called a systemic or remote effect. And how that works is that the light is also absorbed by circulating stem cells and macrophages and platelets and other white blood cells. And when they're absorbing this light, it has this interesting modulating effect on their activity. It's called immunomodulation. And what it does is it shifts these white blood cells that control inflammation. They secrete either inflammatory chemical mediators or anti-inflammatory chemical mediators, and they're triggered to do that depending on what's going on in your body. But it shifts them to secrete anti-inflammatory mediators, which helps control inflammation. So in part, if you're treating the blood around the area, then that's also very beneficial as well due to these systemic effects. Okay, let's get into sinusitis. This particular article is from Stat Pearls. It's on PubMed. You know, you can look up a condition and they have the latest statistics around it. And the latest one is always American-based. Over a 1 year period, there were up to, no, I'm blocking that. There are up to 73 million restricted activity days related to sinusitis and total direct medical costs of almost $2.4 billion USD. And this doesn't include surgery and radiographic imaging. Sinusitis is a big problem. Have you ever had it? And I'm sure everyone has had it, whether it's allergies or secondary to cold or even an infection, which is really technically what sinusitis is. It's terrible. You know, you can't really work. You're just miserable. You don't go to work, all that kind of stuff. Or you go to your work, you're not productive. So anything that can help relieve symptoms would be really appreciated. These sinuses that I'm referring to, by the way, are paranasal sinuses, which are air-filled extensions of the nasal cavity. This is, of course, what I'm referring to. There's other sinuses in your body, but this is what I'm referring to. So there are 4 paired or bilateral sinuses in and around your nasal region. I'm sure you're familiar with some of them. The maxillary sinus, which is on either side of your nose, the frontal sinuses, which are quite large triangular shaped sinuses just above your eyebrow. The sphenoid sinuses on the sort of either side of their inner nose, they're relatively deep, and then the ethmoid sinuses, which lie on the farther outside of your nasal bone and deep in that area. So those are the main paranasal sinuses. Really, to be honest, we're going to focus on frontal and maxillary because they're the largest and the ones that are most important with respect to the symptoms of sinusitis. There are many postulated sort of roles of sinuses, the paranasal sinuses, including, you know, lowering the weight of your skull. I guess that kind of makes sense. Increasing the resonance of your voice, providing a buffer against facial trauma. I guess Mike Tyson would know about that one. Insulating sensitive structures from rapid temperature fluctuations in the nose, humidifying and heating your inspired air. That's kind of a funny way of saying that. And also having some form of immunological defense. That is, it kind of filters and fights some nasty crap as you're breathing in before it hits your passageways as well. Up to 14.7% of individuals surveyed by the NHI reported having sinusitis in the preceding year. So it's a high percentage of the general population. The most common causes of viral upper respiratory infection, and this can lead secondary to swelling or edema and inflammation. And that's kind of where photobomb modulation comes in. It can start to produce thick mucus and it can obstruct the paranasal sinuses. So you feel full and pressure. And can lead to secondary bacterial overgrowth. This is pretty rare, but it can happen. So one needs to be aware of that as well. Of course, you can have allergies that can lead to sinusitis. Sometimes it's referred to as rhinosinusitis, just in general, because there's the nasal cavities as well that can be affected. So bacteria essentially are introduced into the sinuses when you're coughing and nose blowing and there's mucus around and it gets drawn into your sinuses. And next thing you know, you could perhaps get an infection in there. So bacterial sinusitis usually occurs secondary to the viral infection and worsening symptoms after 5 days, and they can be persistent for up to 10 days. So it can be a fairly prolonged kind of issue. So if you look at regular, normal, healthy sinuses, they don't contain bacteria or other microorganisms typically, and the mucus can drain out properly. There's airflow, so everything, you know, should be working kind of normally. However, when you have sinusitis, they get inflamed. there's obstruction, and you get infection and mucus, usually yellowish mucus that starts to build up. This is where you get all the symptoms related to sinusitis. There are really four types of sinusitis. There's acute, where the symptoms last less than 4 weeks and typically get better, usually with, rest and, maybe humidifying and, the basics. I'll run through those. There's subacute, that it takes a little bit longer to resolve, between the 4 to 8 week zone, and then chronic infection. This happens with repeated or poorly treated acute infections. And typically we are into chronic when symptoms are lasting more than 2 months. And then recurrent sinusitis when you're having 3 or more episodes of acute sinusitis in a year. So if you're prone to it, sometimes this has to do with internal issues of your septum and the pathways. It could be congenital, could be due to injury, that kind of thing as well. So sometimes that needs to be surgically repaired. I hear it's a pretty nasty surgery as well. Common symptoms of sinus infection include a postnasal drip, runny nose with thick or yellow-green mucus, stuffy nose, facial pressure. This might get worse when you kind of move your head around or bend over. I think we've all done that before. The pressure can even be felt in your teeth or your ears. Oftentimes, because it is an infectious process, you may have a fever. Sometimes it's associated with halitosis or bad breath. You might have a cough or a headache. Oftentimes feel fatigued and tired. I mean, that kind of makes sense, right? So there's different ways of looking at sinusitis, but essentially sinusitis being an infectious process, but sinusitis can also be related to allergies or even due to a cold. So if you look at how to really figure out what's going on, there's nasal discharge in all of this. In sinusitis, it tends to be cloudy or colored. In allergies, it's usually clear or thinner water. If you've had allergies, you kind of know that it's just like dripping out and it's clear. Cold tends to be thick or maybe whitish. Nasal congestion is typically present in all of them. Facial pressure, always in sinusitis, to a lesser degree in allergies or having a cold. Duration, sinusitis, I went through that much longer than allergies or cold. Well, allergies, as long as you're away from the allergy, it clears up pretty quickly. There's something called double worsening for sinusitis, where you initially feel pretty good and then you get it sort of recurs again. That's pretty common. And then some of these other ones, like bad breath, is usually sinusitis and not present in cold or allergies. Coughing is usually present in most of them. Sneezing, typically not in sinusitis, but as we know in allergies, that's pretty common and often with the cold as well. Standard treatment for sinusitis, humidification, nasal wash, the Nasage, you've seen ads for that, probably decongestants, like pseudoepinephrine kinds of things. Antihistamines have not been shown to be useful unless it's related to specifically allergies. So don't be popping Sudafed and all these different antihistamines unless it's allergies. Sometimes they use topical steroids as well. This might be used in chronic scenarios as well. Antibiotics, I was reading a lot about this. I think the stats, for the most part, don't support the use of antibiotics, even when there's a bacterial infection, apparently. So they are prescribed, oftentimes overprescribed. So really, probably the recommendation is not to take them unless you, number one, confirmed a bacterial infection or the highly suspected bacterial infection. Even then, it may not do much, but that's still oftentimes a standard of care. Now, as far as BioFlex, light devices, how are they going to help? It's really with promoting localized circulation, but especially with helping to reduce inflammation and edema in and around the sinus region. Sinus region is deep to the cortical bone in the maxillary region and the frontal region. So you have to get light sort of through the bone. And you can do that to some degree because it's relatively thin bone compared to other areas of the bone. But again, I'm focusing treatment using more near infrared. I'm going to talk about that shortly. First, a little bit of the research. Now, I just chose two control trials. This one was called Use of Low-Level Laser Therapy. It was published pretty recently in 2022 for patients with chronic rhinosinusitis. Remember, rhinosinusitis is the same as sinusitis. It was a single-blinded, sham-controlled clinic. Sham is a placebo, so it looks like the device, but it's not emitting near infrared. They use near infrared for the research for the most part. 830 nanometers. That's pretty much identical to what we use in our BioFlex systems. 1 joule of total energy. So that's what they use. They treated. They had the whole group treated first with the sham. So they thought they didn't know if they're getting the light treatment or the placebo treatment. And what they did then is they waited for 2 days and they treated with the real light treatment or real laser treatment. Now, of course, the patients didn't know what was going on, right? And what they did was they looked at a total symptom score. So they have, questionnaires about their symptoms, and they would fill these out before and then after treatment. It's called TSS. And then what they found was that after the sham treatment, there was only 5% improvement. After the light treatment, there was up to 34% improvement overall on their TSS scoring system. So it seemed to be quite effective. Another study was a pilot study, again, similar, chronic rhinosinusitis. They used 15 adults, 830 nanometers, 1 joule again, so very similar. And the patients were given treatment 3 times a week for 10 treatment sessions. And overall, the percentage of improvement was considered as a primary outcome. And what they found was that they sort of measured these at the baseline, then at 2 weeks, and then at 4 weeks. That's T0, T1, and T2. And they found that improvements, so based on that total symptom score, improvements were 39% after 2 weeks and 46% after 4 weeks of treatment. So it really did help. So, but thing to learn from this, number one, is near infrared seems to be the best wavelength. And also, too, you're not going to get, you're not going to get symptomatic relief right away. It's going to take some time, a week, 2 weeks, that kind of thing with treatment, especially if you're dealing with chronic rhinosinusitis. Oh, let me just back up a bit there. Sorry. And they found, interesting enough, was a therapeutic effect was sustained for a mean of 5 months. Okay, so that's another takeaway, is that photobomb modulation therapy didn't just help, on a temporary measure. It actually helped for many months after the treatment. So that's a really good thing to know. Remember, there's no side effects of photobomb modulation. That's based on, I did a recent little search, over 1,700 human clinical trials have been done, and none of them have found any adverse side effects. Now, I should quantify that by saying that some people report temporary aggravation of symptoms, depending, when they're first using it, that kind of thing. It's always temporary. And sometimes that's a good thing because that means that the light's doing something. Usually it's on the inflammatory pathway. We know that physiologically, the light isn't actually harming the pathological condition. So it should be noted, again, I'm always going to quantify this, is that don't go to Dr. Google, go to your real doctor. Hopefully you have a real doctor, and, get a good diagnosis, get tested, do the proper things. Don't just go to Dr. Google. I hear he lost his license anyhow. So it is important to understand that photobomb modulation is not treating the infectious process. I'm not saying this is getting rid of the infection. Okay. I am saying that it can help reduce inflammation and edema and the swelling and some of the symptoms secondary to, if it's an infection or non-infection, say allergies, it could be helpful. So as I mentioned earlier, the most effective treatment uses near infrared. The BioFlex personal mini port system, they use 840 nanometers, so it's pretty much dead on to the 830 used in that research. The optimal protocol is to allow light to kind of penetrate as best possible into the sinus cavities. So for that, we're going to use a continuous wave of light. We want the light to be as dense as possible to slowly make their way through the bone and into the tissue. For this, I'm going to choose a protocol that's a continuous wave and for about 8 minutes. And that particular protocol I'm going to mention is in the upper back, and it's going to be the highest level, level 4. So for this particular type of treatment, you're not going to be going stage 1, 2, 3, or 4. You're going to stick with level 4 because it's the dosage that I think would be most effective for the sinuses. So once again, you're going to choose the upper back. You're going to choose stage 4, right? So click on that stages until you get to stage 4. Now, if you're not familiar, or probably are if you're using the equipment, that when you're using the pad, it's first red, then near infrared. Okay, so I'm going to talk a bit about what I want you to do. So remember, really what we're going to focus on here are treating the bilateral, right? Both frontal sinuses and bilateral maxillary sinuses. So what I want you to do is once you've chosen the upper back and chosen level 4, you're going to turn the system on and it's going to run red light for about 6 minutes. So just set it aside, make sure it's not a pillow's not on it or what have you. Let it run and then it will stop, beep. At that point, you can pause. There's a little pause button, right? Put your glasses on, close your eyes, and then you're going to place it over your frontal sinus region and turn it back on. Okay, well, since you're not seeing anything, I would turn it on, then place it over your forehead. Now you have 8 minutes of continuous wave near infrared light over the area. Yes, the glasses might get in the way a little bit, but to be honest, the frontal sinuses are just above the eyebrows, so you should be able to get pretty good coverage there. And again, the light from our devices are not coherent lasers for this application, so it's not going to fry your retina or anything like that, but it's bright. A red light especially, even the near infrared can kind of irritate your eyes a little bit, so you don't want to be staring into it for any given time. And to be honest, just take the safety precaution, close your eyes, put the glasses on, and treat the frontal sinuses. Then when that's done, you're going to take it off. Then you're going to run it again, the red light, let that dissipate, and then put it on over the maxillary sinuses. What I would do though is let it just cool down in maybe 5 minutes or so, 5 to 10 minutes before you put it back on the second placement. I'm getting some feedback from some people saying that it gets warm, and it does. So there's a few things here. When you use it consecutively, you do need to let it cool down a little bit, 5 to 10 minutes before you use it again. You don't want to cover the array really because there's a heat sink involved, and you want the heat to dissipate. The heat is secondary to running the LEDs in the equipment and the electrical current in the equipment. So you want to make sure it's properly vented and allowing the heat to escape. Otherwise, it can get quite warm or even hot. So we don't want that. Let that cool down before you place it over the maxillary sinus. I see there's questions, which is great. Ask away. I'm going to be getting to those very shortly. Okay, so review. You're going to treat the frontal sinuses and the maxillary sinuses. You may have to hold it, especially over the maxillary sinus area because you have the nose. The pads are flexible, so you should be able to flex them over, and you actually maybe get a little bit of the ethmoid or a sigmoid, a sphenoid. I said sigmoid, sphenoid sinuses as well. So you can position the glasses up a little bit higher and then position it and wrap it and gently push it over your maxillary sinuses and kind of hold it into place. Or you can use your cat to push its paw down on it as well too. Speaking of cat, the other day I have a feral cat that I'm feeding. His name is Sylvester, and I've got him almost trained now. He was really good, and I live rurally out in the country, and a red fox has been coming by. So the other day, this red fox came by and literally tried to eat my feral cat. So he escaped unscathed. I had to go out there and break it up a little bit, but he was saved. So there's a little story for a cat story for the day. Okay, so you should be treating the symptoms daily until they resolve. If the symptoms are not resolving or worsening, consult with your healthcare professional. Remember, remove makeup, sunscreen, any lotions, anything you got going on in your skin. Make sure it's all nice and clean before you place the pad on the area. That stuff can, number one, be absorbed onto that silicone pad. It may darken it, may have some kind of, I don't know, reaction or something, or it can kind of plug it up a little bit or reduce the ability of the light to come out. So that's not good. Also clean the array afterwards, each use, 70% alcohol or a alcohol wipe, using a non-abrasive cloth, obviously, or a paper towel, a nice soft one. A mild disinfectant can also be used. Okay, thanks a lot for joining me. Let's take a look at what I have coming up. Next one is on May the 9th. This one is a professional webinar. Again, you're welcome to watch. By the way, if you have a professional equipment, you're going, well, how would I treat it using the professional equipment? Slightly a little bit different, to be honest. I would be using the LDI 200 laser probe for about 1.5 minutes, continuous wave, 100% power. Again, 1.5 minutes, about maybe 30 seconds per point over the frontal sinuses and the maxillary sinuses. If you just have the array, then I would just use the array. I have a lecture on rib issues, everything from fractured ribs to cartilage damage to costochondritis, some stubborn problems around the rib cage. I'm going to talk a bit about that. And then the next one is using the Wave, which is our LED panels, for maybe treating some common skin conditions. So you can, especially the red light, is very beneficial for health of the skin. If you happen to be in Toronto and maybe are a chiropractor or you have a healthcare professional, you're interested, we'll be at the CCA, which is a Canadian Chiropractic Association National Conference and Trade Show this Friday and Saturday. We're exhibit booth number 2, and I'll be speaking at the conference at a lunch and learn at 12:30 to 1. So if you're interested, sneak through in and you can come to the trade show and check out our equipment and so forth. If you have any questions after this I can't get to, you feel free to email me, david@bioflexlaser.com. I've been super duper busy lately, so it may take me a day or two to respond to your email. If you do email me and I don't respond, I apologize. Just shoot me a little nudge and I'll make sure I get to that. Okay, I see some questions here. 1 joule, the dose, that's nothing. Thoughts? Yeah, not a lot of energy, but I believe that was 1 joule per spot, Dan. So that's a good point. I personally think you need more energy to get even better effect. What about treatment of polyps are present? So I don't think there's an issue there. I mean, it's not going to really do anything to the polyp per se. But if there's inflammation secondary to that or what have you, but the presence of polyps aren't a contraindication. Postnasal drip, which causes coughing and runniness. What treatment should I use? Again, I would use this treatment. It might be helpful, although I'm not an ENT guy, right? So I'm not necessarily sure the etiology of postnasal drip. We assume there's some inflammation, so it should be helpful for that as well too. When using the therapist array unit, can it go through the bones around the eye socket and affect the eyes? That's a good question. Here's the thing, right? The only danger to the eye is using a coherent laser where the laser beam is magnified by the lens of your eye to the back of your retina. Okay, so whenever you're using a class 3B laser, you need protective eyewear to ensure that that laser doesn't mistakenly go into the eye. If the eyes are closed and you have glasses on and you're touching bone, and you use a laser, for example, even these pads, you might have the perception of light in your eye. And that's because the photons, when they enter the tissues, they scatter and move around, but it's no longer coherent. It's not going through your lens of your eye. It's freaky for sure, but it's not harming your eye because it's not going through the open eye and being magnified. That's where the danger is, right? Similarly, if you close your eyes and look at a really bright light, you'll see the light through your eyelid, but it's obviously not as drastic to your eye as if you opened your eye, right? If you look at a super bright light, when you start blinking, you see the light that's still there that's stimulating the rosin, the cone cells. But when you close your eyes, there's less of that effect. Hopefully that answers your question. What about the Nano? Yeah, I think the Nano would be all right. It does get pretty warm, so be careful with that one. But you could replace the Nano over the frontal sinus, even the maxillary sinuses to some degree. Just don't push it in so it's touching the skin. It's not designed to touch the skin, so you need to be careful with that. And use the infrared. There's two infrared settings. There's half power and full power. I would use the half power initially and see how that goes. Awesome. Let's see if there's any other questions. Let's see here. Oh, the webinar, skin webinar. Oh, did I? What? Okay, sorry. What did I do here? Oh, March 23rd. That should be May 23rd. My bad. Oh, actually, I should tell that to our website developer. Thanks very much for reporting that out, but it's May, not March. Thanks everyone for tuning in. I don't see any other questions. So I'll let you go and we'll see you next time. Have a great day. Bye now.